Hi, Dr. Bishop. Hi, Colleen.
Hi. Hello.
Thank you for jumping on this Zoom call with me. And I just want to start off by thanking you all in SunCloud for sponsoring the Tri-State Conference again this year and for being a silver sponsor. Really, really appreciate you all. And I thought I'd give you guys a couple minutes to just introduce yourselves and what you do at SunCloud, and then talk about your program and your eating disorder program as well as maybe the other tracks that you offer.
Sure. Awesome.
Yeah.
You want to start? Sure. I'm Nikki, the clinical director at SunCloud Health. So I oversee the residential, PHP, IOP, outpatient pieces. And so here at SunCloud, like I was mentioning, we have various levels of care. We have two residential programs. We have a general residential program and our program that's called at our EDAC facility, which is co-occurring eating disorders and addiction. And from there, our next step down in level of care, and both of those programs are in Northbrook.
Okay. How many beds are in each of the residential programs?
We have 21 beds available at each of our residential programs, and they're
Okay.
kind of right next door to each other.
Okay. So 21 together or 21 in each house?
42 total.
Great. Okay. Thanks.
Yep, absolutely. And for the most part, people will share a room together. But we do have one room that is available. That's a specialty room for whatever complex medical condition is needed.
And
And
adolescents, or what's the youngest you take?
Yep. So for residential, we just do adults right now. Hopefully, somewhat in the near future, we'll be doing an adolescent res, but we're not quite there yet. But we do have both adult and adolescent PHP and IOPs at three different locations.
Oh, great. Good. And so one of the houses is more of a chemical dependency program or mental health program, and the other one has the eating disorder program.
So both of them could be substance or eating disorder. However, we have the specialty program at our EDAC facility, which is our eating disorder and
Addiction Center.
addiction center. Yeah, our eating, we do co-occurring, so we thought we might as well share it together.
Yeah, I appreciate that. Right. Yeah.
But so that facility, you usually would have an eating disorder and addiction. So they're both there together in it. It could be other diagnoses as well, but
Yeah.
there hasn't been many specialty programs that focus on both, right?
Right.
So we don't want a whack-a-mole track option
Yeah.
of it. So we're given an opportunity of, okay, let's work with both of these together and whatever else comes with it. So a lot of complex cases. Our other residential, that is more general, you could have an eating disorder, you could have an addiction, but you also could have trauma, you also could have something else. And usually the eating disorder and addiction aren't both diagnoses that the patient have at
Got
that
it.
facility.
Okay. Yeah. Thank you. And then I'm curious about how you approach nutrition and especially with the addiction piece. And so I'm really curious about that, Colleen.
Yeah, I'll take that. I am a
Great.
dietitian, so I've been involved in our nutrition programs. So we have a dietitian at all of our sites for the patients that they're looking at just where they're at when they come in for their recovery of how they're nourishing their body, what their history is of potential eating disorder behaviors. Whether it's a diagnosis or not, it could be related to trauma or depression or substance use of might be the reasons why they're not nourishing their body. So just getting them started on what a normal day would look like of three meals and three snacks and, providing the variety and educating them on the different macronutrients to make sure that they're understanding why they're nourishing their body with each of these components.
Mhm.
Um, Working on them with maybe portion sizes. Maybe some people are under portioning or over portioning. So working on what a traditional plate looks like. Um, for anyone that comes into SunCloud, they have the opportunity to work with a dietitian, but it's not required. So if you're here for something else, maybe you're, just naturally following a healthy meal plan and it works for you and it works for your lifestyle, then they're okay. They will still attend nutrition group. They just won't have a one-on-one nutrition session that they would do weekly with the dietitian. We also have dietetics at our residential facilities to help with the plating and food support or meal support and monitoring of all those things that they get involved with, actually making some of the food with the patients, and also modeling what just a normalized meal would look like when they're in the facility to prepare them for being able to do that on their own.
And so the clients that have disordered eating or eating disorders, they're actively plating their own meals from the beginning, trying to like get a sense of what normal food plate looks like.
Yeah. If possible, they will a lot of times start, if needed, out with pre-plate, meaning the
Okay.
staff will plate the food with, or I'm sorry, for them, then with them, and then they'll be doing it on their own.
Right, good. And what's your normal length of stay in residential?
I'd say, probably somewhere between 4 and 8 weeks.
Mhm.
Our EDAC program, usually we see a little bit longer of a length of stay because there's a little bit more complexity
Yeah.
that we're working with. But we also know that the longer somebody stays in care, typically the better success they have. So we really work to individualize it with people.
And working with the range of disorder diagnoses, binge eating disorder
Mhm.
as well. Yeah.
Yep. Food addiction, anorexia, binge eating, orthorexia.
And so and I've talked with people at SunCloud many times before about food addiction and um and can you talk a little bit about how you all conceptualize treating that, someone who's coming from maybe an OA philosophy and wanting and maybe needing to have their meal plan be a little bit different than somebody else, and what your philosophy is around that?
Yeah. Do you want to talk
Sure.
about the diagnosis and I'll talk about the food?
Yeah, and I'll share a little bit too, because we started a research team here at SunCloud where we're doing a lot of research on food addiction and just our program in general and eating disorders in general and trauma and addiction. But one of our biggest focuses is on the food addiction piece. So as of right now, there's not much data or treatment plans or protocols for treating food addiction. So that's one of the biggest things we're focusing on is coming up with an intervention and a model for treating food addiction and seeing how successful it is so that we could give it as an opportunity for people to utilize it throughout the field. So typically when we are treating somebody for food addiction, now when everyone comes into our program at the beginning of care, any step down in level of care or any discharge, and 6 months after and a year after, we have a bunch of different screening assessment tools, and one of them is called the YFAST, the MyFast, the modified YFAST, where we will look at people's scores on food addiction so we can actually assess it. And with that, one of the biggest, the ways we've been working on treating it and doing the research to back it up is giving people 3 different options. So one might be treatment as usual, typical eating disorder treatment, not really focusing on it much. We're just going to kind of continue as normal. Another one would be kind of we call our harm reduction approach, where we might take red light foods or yellow light foods and foods that are a little bit more riskier, and we're going to maybe look at shifting some of those foods out in their nutrition plan. And then there would be the one where it's basically we call it like our abstinence-based approach. So really looking at from the addiction lens, and where we would look at like ultra processed foods, especially like all the ones that would impact that person's recovery process from food addiction. So starting to shift some of those, all of those out as well. So we'll give people different options of which approach they're willing to try and kind of go with them from there. So that's one of the protocols we're doing right now.
Yeah.
Kind of see how successful it is.
That's really great. I didn't know about the research piece. That's really great.
Yeah, that's a huge part of it. So it's really important that the patients that are working on that type of meal plan are specific to the food addiction. It's not just an approach that's provided to all of our patients.
Mm-hmm.
Yep. And then with them, I'm really curious about this, with then the meals together, if they're on kind of a different track, is everyone still eating together?
Yep. Everyone's still eating.
Staff is just kind of managing any of the parts that come up around that.
Exactly. Yeah. Think of it no different if you were allergic to nuts and I was allergic to eggs. We could still have a meal together. And our food could sometimes look the same, sometimes be different, but it's It's what's appropriate for my mind and body might not be the same thing that's appropriate for yours, but we're
Yeah.
still nourishing our bodies in the same ways.
Great. Thanks for explaining that. Yeah, I think that's really helpful.
Absolutely. And kind of like one thing that you were naming and Colleen was naming, I think one of the things we really do well here and really strive to work on is individualizing care for each and every patient that comes in. And so I think this is one example of like the subset of clients we're working with that have food addiction, of how we're going to tailor even for that group what it's going to look like. And so whether it's trauma, addiction, food addiction, eating disorders, mood disorders, we really, really work hard to tailor our interventions
Yeah,
to individualize care for that patient.
it's great. That's really great.
So it's a slow process. We would do a lot of education with the patient. The therapist could be involved, psychiatrists, for sure the dietitian, of what this even means, what this looks like, what their meal plan could be. And we can, our goal is longevity. So we take it slow. We meet them where they're at in the sense of what changes can we make, like Nikki was saying, like which of those phases. And then from my experience, as soon as patients start seeing like the benefits of this, they get really excited and on board with it. And it results in a very successful recovery because we're noticing that if they don't follow this, there's going to be other barriers to the recovery.
Yeah, yeah, that's really amazing. And do you see that, like, where do most of your clients come from? Are they from kind of Illinois, Chicago area?
I would say most of our IOP, PHP patients are local. We do get some people that come in from other states for a residential program. And then if they can, they'll stay for PHP, IOP if it makes sense for their living situation. Otherwise, they'll go back to their hometown for the PHP. And we work with that program of the appropriate step down in transition.
Great. Okay, so I know we'll have links all connected to the video if people want to find out more or reach out. And anything else you want to say about the programs?
I know I would just echo what Colleen's saying too, is we're starting to get more and more people from different states, the Midwest, all different places. So we definitely will work with people from wherever they
Right.
are from.
All right.
We
All
have
right.
a strong team that from the second they call all the way till the end of discharge, they're working with multiple team members that are involved in their care. And that would also be a resource for their referral source, their outpatient
Great.
providers, their new team
Yeah,
that they'll work with throughout their stay.
perfect. Great. Okay. Thank you both so much for taking time to
Yeah,
take the
thank
call.
you. We appreciate it.
All right,
We're
thanks again for
excited.
your support for the conference.
Absolutely.
All
Yeah,
right.
thank you.
Bye.